Leicestershire Partnership NHS Trust's 700 community nursing and therapy staff have been working hard throughout the pandemic, keeping COVID and non-COVID patients safe in their own homes.
I'm really proud of the work that the nurses here and everywhere have done. Coping with it, I think we've coped really well. The nurses have adapted. We've had no shortage of PPE, so they've adapted to the use of the PPE. We've had good, clear instructions with our daily COVID reports and our matrons' daily reports, which has made everybody feel supported. And I think on the whole, the staff have done really, really well.
How common is it to see a patient who's COVID positive?
It's quite common out in the community. There's quite a lot of people being discharged from hospitals going into care homes. So care homes are having to isolate. People are having to isolate in homes that have got it. So it's more, people don't know about it out in the community, but it is more common, especially in the elderly, we've noticed.
And what would happen to these patients if there was no community nursing service?
They'd be on their own. Some carers have backed out. Family members can't go visit them. So we're their only source of people who they get to see, and they're getting lonely.
And have you worked with patients who are COVID positive?
Yep, we've got a handful of patients, or quite a lot actually, who we're trying to keep at home, or we're trying to facilitate them to come out of hospital that little bit quicker so they don't have to be in hospital.
The thing that I would recognise the most is how we have all come together to make this happen. We won't be in the situation we are now if we didn't have the support from the care homes, from the staff that have been redeployed, with the help from the families, the carers and the patients. If we didn't have that, we wouldn't have got through this.
I'm especially proud of the way the team have taken on the end-of-life patients that have come home either from hospital or have been diagnosed at home and carried out their end-of-life care. We have managed to put personal care packages in for these patients from our own staff with the help of social services where we can source staff from, and we facilitated that so that patients have been able to die at home, which was their wish, rather than in hospital.
And how much has that meant to you?
Everything. I think that's one of the most important, for me, that's one of the most important aspects of my role, is to facilitate patients' wishes.
It's almost like hospital but from home, so we're offering the same sort of care that not quite the same, but kind of the same sort of care as you would expect in hospital, but in their own environment, which is a lot nicer for the patients, for the relatives, but also for us. It's quite rewarding that we can actually see them get back to doing a little bit more for themselves.
Just the times of us all working together and helping each other, and all the patients that we've lost, just remembering them as well, and just seeing all the new people that are coming in and they actually appreciate what we do for them, and vice versa really.
Are you treating patients who've got COVID positive? How's that going?
Yeah, we are. We've mainly seen these patients in the residential homes, unfortunately, and we're treating them the same as we are treating everybody else, obviously with the PPE and the support of the care home staff, who I actually don't think have had enough credit throughout all of this. They've been amazing.
We have daily COVID updates come from the communication team. We have action cards with regards to what PPE we need to use. We have hand hygiene audits to make sure that we're all being cleanly as possible. We have got the PPE we need, so every patient that we're going into, we're prepared for that scenario, whether they're positive, not positive. So yeah, we are 100% prepared for this.
So you've got the PPE on,
Yeah.
so you're treating patients the same?
Yeah, irrespective of whether they're positive or not.
Okay. And is it uncomfortable wearing all that PPE?
Particularly in the warm weather, the masks, you do get quite hot and sweaty, but we're getting through this, so it's good.
And those who've got like dementia, for instance, they might have a set routine, they know where things are. For those who are maybe like partially blind or hard of hearing, they might have assistive technology in the property that might help them recover that little bit more quicker. And I guess from a patient point of view, it's a bit more functional for them and a bit more meaningful as well compared to in a hospital setting where rehab might be focused slightly differently.
I have heard that some nurses have been have had some negative public response, especially as we're seen out in our uniforms on a daily basis, which we have to be because we are community nurses. But in Hinckley, I have to say that the only response I've ever had has been very positive. People have given me thumbs up and said thank you and thanks for your hard work, which I find highly embarrassing. But they've been, on the whole here, very nice to us. We haven't had any negative responses that I'm aware of in Hinckley.
People are saying we're doing really good jobs. They're saying thank you for your help, and we've even had like treats from patients saying like, here you go, thank you for helping us.
Because we're the ward without no walls, we are out and about, we're in and out of our cars, and I have got quite a few round of applauses from members of the public, and they're really thankful. And if like we need to go and get a quick drink from the shop, we've got members of the public and obviously people working within the shops that are actually giving us priority so we can get out and do our job as best we can.
So how does it make you feel when a member of the public bursts into applause?
It's really nice actually. There was an incident where I was at a set of traffic lights and somebody rolled down their window and said thank you for everything you do, and it is really, really rewarding. You don't get that from any other job.
It's been quite embarrassing really, because we've had lots of cheers and lots of applause, people tooting their horns, and that's not just my team but I'm sure the wider team as well, but also on my street where I live in the local area, when the Thursday applause was happening, a lot of them did come out and cheer us on. So yeah, it's been really quite a rewarding experience.
Just remember us as a team. We are out here, it's not just in hospitals, and we do like to help and we like to make a difference. Thank you.